Yes, I can start. Good afternoon, everybody. Good afternoon, the panel. Thanks for being here and for staying this late. Well, 20 years ago, I almost lost my sister to misdiagnosis. How terrible can that be? Living in Cameroon then. Fast forward, we only have 5 minutes. I can't tell you the whole journey. I moved to the Netherlands. I get the luxury to get technology knowledge, to work for Philips, to work for Office Depot, acquire a lot of knowledge and see digital health becoming an explosive topic. So starting up MEDxCare with my sister was driven from that occurrence and that experience. Now, my name is Patricia Monte, founder and CEO of the first type of digital hospital you will hear more about right now. The focus is emerging country. We do start in Africa, obviously, because I come from there and I think there's a big need there. Can I have the clicker, please? Someone left with the clicker, sorry.
Where is he?
Sorry. Thank you. This was great for the Friday afternoon. Well, let's continue then. Now, moving forward, what is the problem that we are solving? Because when we look at healthcare, I mean, we've heard from farm access, we've heard from funds that are available. We focus on providing access to quality healthcare resources. And that we do by having a solution that connects, let's make it simple because I have loads of words there. We connect medical professionals from the developed world with medical professionals in the developing world, but on the other hand, we also connect patients in the developing world with medical professionals in the developing world. So you see a business model that has two angles, two possibilities, and in between there are healthcare resources that are available. I see that, Dan, this is not the last slide I sent you, but we're going to manage with that. So from the problem and solution, I hope the solution was clear. I had a different slide where you could see the screen of the mobile app. So we have a web-based application today where you can see the interaction of an individual, finding a doctor, connecting with the doctor, and being able to pay through a kind of what we call a cash-to-health model. It's a bit called today, I mean, during the whole conference, I heard a lot of people talking about international remittance. So we tap into international remittance in order to provide healthcare between the two interactions I told you about, doctor-to-doctor connection or doctor-to-patient connections. Now, when you look at this business model, I mean, it's pretty clear that all the services we sell, 10% of any transaction that is happening, we get our money from it. And what you can also see is there's big opportunities. Later we can discuss why those countries, because we did an extensive study. What is not yet available here, I would love, sorry to come back, I would love to touch a bit about the team, which is not available in this slide. So the reason why we believe we can make this a success, we've already somehow made a big step because the platform is up and running, 8,000 doctors are already available in there. We have a team with a board consisting of the Chief Medical Officer of Dell. He recently moved job, but he was Chief Medical Officer of Dell. We have a General Manager of Philips, part of my board, and a medical doctor of Harvard. So they are supporting me in making it happen and in moving it to the next level. Together with my sister, we founded it. We both worked for Philips in the medical field, in the lighting field, worked as well with Office Depot. We designed a business model of a full European organization. So the experience is there. And at this stage, I have 10 operational guys with whom I'm working. Now, on the last slide, because we have 1 minute left, why do we want and we believe and we hope you can invest in us? For the last 3 years, we've been working hard, bootstrapping, to make visible that it can be done. Because like I said, that interaction was already a problem. Creating the different resources in between in terms of healthcare was another problem. So think of consultation online, think of buying medication online, think of the funding transaction online as well that needed to happen. And we are now at the stage where you asked the question earlier, 8,000 people subscribe, but what we see today is if we don't educate them to get through the rest of the customer journey funnel, it stops. And we try to do it today with webinars and with some online events, and with finding partners locally, it's tough. So we need the money in order to push further on the market, to sell further the idea, to build a brand, and hopefully to turn it into a $1 million business. So what can I say? Let's make the world a better place and a happier place.
So, existing products, 8,000 doctors already on the platform, background with field of medical, experienced board. What are we missing?
What does the company do?
We sell healthcare. We sell healthcare resources by providing access wherever you sit in the world.
So, help me understand. I'm a HMO, Health Management Organization in Rwanda, and I'm looking for a pathologist. I'd come to you.
You can come to me.
Okay.
So the first thing you will do is you will create a profile, and from the profile you will be able to search on our full medical or our care provider database. That doctor can be a local doctor, so if he's around you, but it could be beyond your border, because we've realized there's lack of resources in many of the countries that we're going after. If he's locally, you make the appointment and you can pay from your wallet. That can be money put by family members, or you can pay yourself. If he's abroad, and then you can go to the doctor and have your consultation. We pushed it a bit further because we have medical record available in there, so you can later share it with a different doctor. If there's no specialist locally available and you find one in the Netherlands, you make the appointment, start an encrypted, very HIPAA compliant video conference in order to get that discussion going.
So it's like an Upwork for doctors or Upwork for medical people.
I would see it more as an Airbnb style than Upwork. From a medical from a care provider point of view, fully agree. But because of the patient angle of it, it goes beyond just being a workspace for doctors. That's why I said there is two models. There is doctor-to-doctor connection, and then you see it as an Upwork, but there is a patient-to-doctor connection.
Well, the Upwork part was the patient to doctor I was saying. So I'm looking for, somebody who can treat my pregnancy, for example.
Yeah, you find it with us, absolutely.
So and we connect online. It's a website.
You connect online. We're finalizing the mobile app at the moment, and you will be able to do it mobile app. But our web platform is also native, meaning on normal tablet and mobile is usable.
Live, up and running.
Yeah, absolutely.
What's the biggest, you have 8,000